find ourselves in the midst of an obesity epidemic. Obesity in adults has doubled and in children has tripled in the past 30 years. We know that the underlying cause of this epidemic is insulin resistance. In other words, you're just not as sensitive to your insulin as you once were. The body compensates for this abnormal metabolic state by actually producing more and more insulin to compensate for this insulin resistance. However, as these blood insulin levels rise, you start gaining an unusual amount of weight around your middle, central obesity, your blood pressure increases, your triglycerides, another fat in the blood, goes up, cholesterol levels increase, and that good or HDL cholesterol decreases, and your blood sugar begins to rise. Now, all of this eventually leads to diabetes. However, we are now beginning to appreciate the fact that this also significantly increases your risk of having a heart attack. This is why this central weight gain is called killer fat by most physicians. An investigation reported in the July 17, 2013 Journal of the American Medical Association focused on the effect of long-term obesity that began in young adulthood and led to early heart disease by middle age. The concern was the longer the duration of overall abdominal obesity and its relation to premature hardening of the arteries that increased the risk of having a heart attack. This study looked at over 3,200 young adults ages 18 to 30 who were followed for over 25 years with the use of CT scans of their coronary arteries to determine the amount of calcification in those arteries. They also measured their body mass index and waist circumference at baseline and throughout the study. During the follow-up, 40% of the participants developed obesity. These researchers documented that the longer the duration of obesity, the greater the risk of developing coronary artery disease or heart disease. Those individuals who developed their obesity in young adulthood had the greatest risk of developing hardening of the arteries early in middle age. This study has shown us that the preventing or at least delaying the onset of obesity in young adulthood may lower the risk of developing hardening of the arteries through middle age and beyond. Obesity is not just a cosmetic problem. It is a sign of a more serious underlying metabolic changes that cause our arteries to age much faster than they should. Obviously, the longer we suffer from being overweight and obese, the more damage that is done to our arteries. Even though this study did not look at the very young children who are overweight, you could conclude that developing obesity during childhood is even more of a risk. These researchers noted that there are certainly a number of factors that are associated with this central obesity that can cause accelerated aging of our arteries. This is that elevated blood sugars, the high blood pressure, elevated cholesterol and triglycerides, along with that low good or HDL cholesterol. However, they noted that this central fat also produces significant inflammatory products that increase the amount of inflammation found in our arteries. Remember, heart disease is a result of low-grade inflammation in your arteries that occurs over a prolonged period of time. The truth is the fact that overwhelming majority of these cases are the result of poor lifestyle habits, a poor diet, and lack of exercise. This study shows us that paying more attention to our children and young adults who are showing signs of an expanding waist size is more than just a cosmetic problem. ARIIX is a nutritional and opportunity company that is providing products and programs that are clinically effective in helping any individual, including our children and young adults, and give them the opportunity to establish their healthy weight and maintain it for a lifetime.